The new data can be divided into sort of pre-symptomatic and symptomatic spinal muscular atrophy trials with respect to nusinersen. And the pre-symptomatic trial, which is NURTURE, are babies that were diagnosed earlier because it was either known that they had another family member or circumstances around, fortunate circumstances that allowed for diagnosis early. And the NURTURE data basically is a continuation of the update on the study. And this has shown that these children are continue to be free of ventilation and or death, but also are making improvements with nusinersen. The SHINE data is the study that relates to children who were diagnosed as infants and treated as infants, and they have rolled on to this long-term extension study. And that basically shows that they are, the safety is preserved, but they're also continuing to show improvements as the data is being organized and analyzed in the long term.
So I was particularly interested in some of the more recent data on NURTURE. NURTURE is the pre-symptomatic study, as you know, and some of the patients who had 2 copies of SMN were not achieving independent walking, which I think we were a little bit surprised by. So they're not doing perhaps quite as well as we had hoped. The other thing that was interesting that's coming from the NURTURE data is the use of neurofilament heavy chain, and on day 64, how there's a predictability to what the level of neurofilament heavy chain is on the age at which these patients achieve independent walking.
The NURTURE data also showed that the putative biomarker, which was phosphorylated neurofilament heavy chain, showed a decrease in children that were treated with nusinersen. And there was a rapid decline after the loading phase and stabilized in the maintenance phase. This actually brings up a good point of a biomarker that we can actually follow in SMA, making it a biomarker also for the future in other studies.
So let me talk about the NURTURE study first, which is the study of treating pre-symptomatic infants with nusinersen. Pre-symptomatic meaning they are diagnosed even before they show any type of symptoms like weakness or hypotonia. And as soon as they get diagnosed genetically with spinal muscular atrophy, they get treated with nusinersen. And now the study has been going on for about 3 years. We have data worth of around 3 years follow-up, and that had showed significant improvements and continue to show improvements for these 3 years. So that kind of talks to durability of the treatment with nusinersen and also the safety associated with that. And there were no serious adverse effects or adverse events related to nusinersen that we already knew about before. The study also emphasized that earlier the treatment, better the outcome. And the main thing that clinicians should take away from that is, with this early treatment, treating the pre-symptomatic infants with spinal muscular atrophy is changing the natural history of spinal muscular atrophy, and these kids actually developing normally. So in future, there might be a chance that we may not be seeing any patients with type 1 spinal muscular atrophy that we used to see because of these advanced treatments. So the SHINE study is something that focused on children with spinal muscular atrophy, mainly later onset spinal muscular atrophy, a little bit older children. And that also showed durability of treatment. We have about 5 years worth data, follow-up data from that study. And that showed, again, steady improvements or maintenance of the motor milestones in these patients with spinal muscular atrophy who were treated with nusinersen.